we're going to talk about some patients and talk about our experiences. Do you have a patient that comes to mind in terms of dry eye awareness?
I do. So dry eye is definitely personal for both of us. I have dry eye, you have dry eye. The patient I'm thinking about is a friend of mine actually that came. She flew in from a few states away, was unable to work, unable to drive, couldn't even open her eyes. They were so dry and inflamed unless she mechanically pried them open.
How did that impact you when your friend came in with dry eye and kind of telling you all that, the story?
It really hit me personally because this is a good close friend of mine. She's exactly my age. We have kids the same age, and I was watching her struggle. And she had seen 6 different doctors. She'd had lots of treatments. No one had been addressing her dry eye.
Yeah.
How about you?
Well, we get patients from all over the place, so they come and fly in. So there's a big problem. Some doctors don't want to deal with these problems, or we have patients that have seen several doctors.
Right.
And then when they get to us, they're at their wits' end that they've been dealing with this for so long. The one that comes to mind for me is a younger patient, so this kind of goes against what people think when they think about dry eye, that's just older patients. But she was in her 20s, a grad student, very smart, and the dry eye was affecting her to the point that she wasn't thinking about going into her profession because she didn't think she'd be able to be a professional and deal with dry eye. And she was getting into that cycle of depression, and then she finally came to see us. Now she's been a patient of ours for like 12 years, and she came in and she showed me that she's married, she went through grad school, she's got a job, she's got kids, and basically she was crying, just giving me a hug, telling me that I'm so glad that I came to see you guys and get treated, and I didn't think my life could be this good.
Right. We've seen patients come in with disability papers, feeling like they couldn't carry on with their profession. These are people in their 20s. So even really young people that can't interact with their families, they're not socializing, they're not functioning the way they should. So I think it's really important to catch those patients before they get to that point, hopefully treating them early so that they don't progress.
What patients will tell you is that they go and tell their friends or tell their doctors they have dry eye, and basically they think it's just a nuisance. But this is a debilitating disease that if not treated, these patients, their lives are affected. We see this every day with patients coming in and just telling us how their lives were one way, they got dry eye, their lives are turning another. And then the other perspective that we have is we have teenage daughters who are experiencing dry eye because they're sitting in front of their screens, and we can empathize with all these other people that are coming in because we have the same problem at home.
And we see generations of patients in our office. We might see a patient that brings their mother in or even their grandmother, and you can see kind of the progression. If you don't take care of things, it just gets worse. With every generation, every decade, it just gets worse and worse. So it's very rewarding to treat these patients. I think now as refractive surgeons, we're all very invested in making sure our patients get the best outcome. And that's important for surgery, but it's also important for our patients.
If you ask your patient about dry eye, they'll talk to you about it, and then all of a sudden it starts a whole new conversation and opens the door that these patients are suffering from dry eye and that you are really capable of trying to treat that, don't you think?
Right. I think the most important thing is just to listen to the patient. Not only will they tell you with their fluctuating vision and their very consistent symptoms that they're having dry eye, but they feel validated when someone hears them.
And I tell doctors the same thing. Be aggressive about treating. The great thing about ophthalmology is we can actually use a microscope and see what's going on with their eye and their glands and all these other things. And if we see it, we should say something about it. So if you see something, say something.
If you see something, say something. But just like my grandmother always said, an ounce of prevention is worth a pound of cure. So if you treat early, a lot of times you can prevent it from getting bad like we've seen in our clinics.